Most people think ICU care only possible inside the hospital walls. But what if I can tell you that you can replicate the same thing to home, which can monitor critically ill patients with the proper ICU setup like cardiac monitors, ventilators, and all other setups which is required for a critical care monitoring. Cities like Bangalore, Hyderabad, Chennai, all these cities they are already in the verge of changing the thoughts like why to keep the patient in ICU with a higher budget like 50,000, 1 lakh rupees per day. Why can't you shift the same care to home, like keeping an ICU setup at home? That's when Avanta Healthcare steps in. Like we set up the entire home into an ICU setup, keeping ventilators, cardiac monitors, suction machines, oxygen support, round the clock critical care nurses, doctors on call. All these things can be arranged at the home setup also. People thinks home ICU is lower safety or less monitoring, but it's a myth. The same kind of care and monitoring can be done at home, except handling the unforeseen criticalities. Like if you want to do an emergency procedure or if you want to do an immediate scan or something, it will not be possible at home. But most of the monitorings, critical monitorings, or the follow-up can be done at home also. So here is the question: when full care is possible at home means why do you want to waste your time at hospital, spending lakhs of money together and getting hospital-acquired infections? So change the thought, think of an ICU setup at home. It will change the care what we give to the patient. So if any support is required, please be in touch with Avanta so we can set up an entire ICU setup for yourself or your patients. Thank you.